we're going to continue on mentioning the one cartilage that we haven't said yet, and then we're going to do the joints, the ligaments, and the spaces of the larynx. All right. This will be the last section before the muscles. So we have the epiglottis and this big larynx. The epiglottis is right here. So it is this, looks kind of like a leaf, right? And you stick it in, it's towards the front of the larynx. So here's the anterior, here's the posterior, so it's towards the front. The top of it kind of comes up right behind the hyoid bone, and in fact, when you're looking down someone's mouth, right, the tongue comes out from here, and if you look down, you'll see this shape that's kind of like a moon shape or a thin, curved shape, and you're seeing the top of the epiglottis, all right? In these other larynxes, I'll just point out, so here, this bigger one, here's this one, you can see the epiglottis, this whole thing is kind of the epiglottis, but you really just see the blue here is always cartilage, right? So here is the epiglottis on the side, and here you can kind of see it there in the front, all right? And this little one, kind of the same thing. We have here is the epiglottis coming down here, all right? That's the epiglottis, here's the hyoid bone, here's the thyroid cartilage, all right? The aryepiglottic folds in the larynx, the names are very, very logical. So ari is referring to arytenoids, ari, and epiglottis is referring to the epiglottis. So it's the folds between, the arytenoids are back here. Here's the arytenoid. Maybe it's more clear on this one. Yeah, here it's a little more clear, right? So here is the arytenoids. Here is the epiglottis down here. And so all this tissue right here, this is tissue that has some muscle, mostly connective tissue in it, mucus kind of membrane covering it. These are the aryepiglottic folds up here. All right, in this model, they're taken off. But you would see them coming here between the arytenoid, kind of coming around and coming on each side from the arytenoid to the epiglottis. Here you can see it quite well. I'll do this one, it's a little easier to see. So here's the epiglottis in front. This is the arytenoid in back, and so it's all this fold of tissue up here. This is the aryepiglottic folds. This white line here is the vocal folds. So the aryepiglottic folds are kind of connecting the arytenoids to the epiglottis and this whole section above the vocal folds. All right, that's aryepiglottic folds. Then we have the joints. And these will be seen best on this model because the joints are between the cartilages. There's only 2 joints in the larynx, and it should be pretty, they both start with cricoid. There is a cricothyroid and a cricoarytenoid. So just don't mix them up. It's very easy to keep them straight if you just think for a minute. Right, so they both start with the cricoid, and then the cricoarytenoid is going to be here. It's going to be where the cricoid touches the arytenoid. That's the joint. So right here is the cricoarytenoid joint. This is the joint that when the arytenoids are moving, they're adducting and abducting the vocal folds, all right? One on each side. So that's the cricoarytenoid joint. That's all about opening and closing the vocal folds. Adducting and abducting the vocal folds. The cricothyroid joint is going to be this one right here, right? So this is the only place, if you look, the cricoid here isn't touching the thyroid, the cricoid here, it's only on these 2 sides, but the bottom of the inferior horn on each side is touching kind of the back of the arch of the cricoid. All right, so if you put like a tack right in here, that would give you this joint, which is a pivot joint, where this thyroid cartilage can move down like this, kind of pivots on that little joint. And that lengthens and tenses the vocal folds inside, because part of them stay in the back, and then this front part where the vocal folds are attached to the thyroid moves forward a little bit. All right, that is the cricothyroid joint. All right, now we'll talk about ligaments, which will not be on this because this is basically just has mostly the cartilages, and most of the ligaments have been taken off except for a few. So we're going to look at the littler larynx all right? And again, the names are very, very logical. So we have the hyothyroid membrane and ligament, all right? Hyothyroid, so this would be together like this, but we'll just use this model. So you look for the hyoid bone here, you look for the thyroid cartilage, and then what is the membrane between them? It's all of this. So all of this gray, and it goes completely on the other side too. This is the hyothyroid membrane, all right? On this model, you see the same thing. Here's the hyoid, here's the thyroid, this is the hyothyroid membrane in gray. Ligament and membrane, the only difference between them is ligaments are a little bit thicker. So sometimes people use them a little interchangeably. People sometimes say the middle here is a little thicker. So they call that the median hyothyroid ligament. And then they also say here is the lateral hyothyroid ligament. So in the lateral side, it gets a little bit thicker too. Between the greater horn and the superior horn, this is thicker. So this is the lateral hyothyroid ligament. And inside it sits this extra little cartilage. Do you remember the name? This is the trapezial cartilage. So this is the lateral hyothyroid ligament. Here is the lateral hyothyroid ligament, and the trapezial cartilage sits in there. All right, then we have two ones that sound kind of big names and scary, the hyoepiglottic ligament and the thyroepiglottic ligament. But they're very easy, again, if you just kind of think. So hyoid bone, hyoepiglottic, and the epiglottis. And so what connects them is this kind of gray-white fan right here. This is the hyoepiglottic ligament. It's kind of a triangle, all right, between the epiglottis and the hyoid bone. That is the hyoepiglottic ligament. On this model, you can see it right here. Here's the hyoid bone, here's the epiglottis. So this is the hyoepiglottic ligament, that triangle there, okay? Then the thyroepiglottic ligament is going to be, well, here's the thyroid cartilage, and here's the epiglottis. So it's actually going to be here, this kind of white-gray right here. That is the thyroepiglottic ligament. And on this little model, you can see it's labeled. It has a little number on it. It's this little, between the thyroid cartilage down here and the epiglottis up here, there is a thyroepiglottic ligament. Okay, then the cricotracheal membrane, that is actually on this big one again. So you find the cricoid, that's here, and this is the trachea below it, all right? So this whole top membrane that goes all the way around here, this is the cricotracheal membrane, all right? On this one, you can hardly see it, but it's down here. There's a membrane here, cricotracheal, between the cricoid up here and the trachea right here, cricotracheal membrane. All right, and on this one, you can see it a little better, right? So the cricoid is up here. Here's the cricotracheal membrane right there. Sometimes this is called the cricotracheal ligament because it just depends, ligament and membrane kind of depends how thick you think it is. All right, then we have the conus elasticus and the quadrangular membrane, okay? So we did this more in class, so it's a little bit easier to remember. The quadrangular membrane is this whole top part, which includes mostly the aryepiglottic folds, and it includes something called the vestibular ligament. The vestibular ligament goes right up here and makes up the false vocal fold. So you see inside this, this whole thing is the quadrangular membrane. It's mostly, this is all the aryepiglottic folds I told you before. But right here, these are the false vocal folds. So you kind of see there's like a ridge on top, and then there's like a little space. We're going to talk about that space. And then the true vocal folds is the white line here underneath. So the true vocal folds are underneath, the false vocal folds are on top, and the false vocal folds and the aryepiglottic folds together make up the quadrangular membrane. All right, so in this structure, let's see, the vocal folds aren't white, but they're that lower They're the lower ridge here. Those are the vocal folds. This ridge right here. This one, true vocal folds, this is the false vocal folds on top. And so the false vocal folds, the vestibular ligament, which is inside them, and all these aryepiglottic folds, this whole top part above that space, that is the quadrangular membrane. The conus elasticus is the part below it. So there's kind of a cone shape here going from the cricoid to the, going from the thyroid cartilage in front to the arytenoid and the cricoid. This whole space here underneath is called the conus elasticus. It's a membrane, all right? And the same thing here, it so goes right underneath. It kind of includes the vocal ligament, which is in the vocal folds. Goes back to the arytenoids and the cricoid and up to the thyroid. This is the conus elasticus. It's kind of in a cone shaped, the conus elasticus. Okay, then we just have the spaces of the larynx, all right? So I think I'll kind of put these together real quick. The additus laryngeus is the opening. So you call this space, it's kind of just the space that's the opening. That is called the additus laryngeus, all right? Additus laryngeus. If we put these guys together again, it's this kind of just this space that's almost like a flat space. But when you talk about the opening to the larynx, that is the additus laryngeus, all right? The glottis is the true vocal folds, which are right there. So the supraglottal space is everything above them. This is space, right? We said that is kind of the quadrangular membrane and the aryepiglottic folds, but the space above the true vocal folds is the supraglottal space, all right? And on this structure, this whole thing above the true vocal folds, this is all the supraglottal space, okay? Below it is the subglottal space. So anything below the vocal folds is subglottal. So this space down here, all right? On this one, it's this space down here. This is the subglottal space of the larynx. So it just goes down through the cricoid, bottom of the cricoid. The glottis is the space between the vocal folds. So even in this structure, that is the glottis. It's sometimes bigger, sometimes small, right? You can't really see it in these guys, but it's the space between the vocal folds that can open and close. That is called the glottis. Sometimes it's called remiglottitis if you're doing the whole name. Then ventricular folds and the vocal folds are going to be, ventricular is another name for the false vocal fold. So I said before, this top ridge, this is the false vocal folds. It's superior to, but it's not, it doesn't go in as far. It's not as medial as the true vocal folds. Here's the true vocal folds underneath. On this one, these are the false vocal folds, which is also the ventricular folds. Sometimes they're called the vestibular folds, and this is the true vocal folds underneath, all right? And then here we just have the true vocal folds. The false vocal folds would be above them, and they wouldn't come as far medial. They wouldn't come all the way to the center. They'd kind of go from here to here. And then lastly, we have the ventricle and the vestibule. So the vestibule is going to be the space. We said the whole thing down to the vocal folds was the supraglottal space. But from the false vocal folds to the top is called the vestibule. So from the false vocal folds to the top is the vestibule, not including that little space in there. Because this little space in here is the ventricle. All right, so the space between the true vocal folds and the false vocal folds is the ventricle. And it's a pretty, you can see it, it's pretty big space. Same thing here. This space between the true vocal folds and the false vocal folds, this is called the ventricle. The space above the false vocal folds to the top, that is the vestibule. All right, so so there's two V's. Vestibule is on top. The ventricle or ventricular space is between the false vocal folds and the true vocal folds, and that's really important because that has lots of little glands in it to secrete mucus to help moisten the vocal folds. And that is it.